Tired of being nosy? I knows how to help you.
Imagine the day they see you again. And you are just, well, better.
Hi everybody, Dr. Anjana Bhana here, and welcome back to my YouTube channel. So we have previously talked a bit about non-surgical rhinoplasty and shaping and sculpting and shrinking the nose a little bit using chemical means, so that would be using botulinum toxin to reduce the nose. And I actually, last week I had to go to, it's called the AAM, American Academy of Aesthetic Medicine, and there was a whole batch of new doctors getting into aesthetics, and then I went to go speak about the EndyMed and FSR and the radiofrequency microneedling. And one of the doctors asked me about rhinoplasty and using the intensive or the radiofrequency microneedling and the effectiveness of it. And we've never really looked into that, even using radio frequency. So I said, possibly due to the collagen remodeling, you might get a bit of tightening in the area, and that could be, like a sort of a, I don't know, like an illusion, an optical illusion. But I thought, maybe I should go try and find a study on this, and I found a study. With Tanaka. So Tanaka's done a lot of work with resurfacing with radio frequency as well as microneedling with radio frequency. And it was a study with 15 patients in terms of the longevity with these treatments. And what it was found that in the perioral around the mouth area and the nose area, that there was lifting using the radio frequency microneedling, but not really shrinkage of the area. So the bulb remained the same. But I did come across another, but this was now, the doctor asked because she saw it on social media, and you know how the phone listens to us and listens to our thoughts and listens like with everything. So my phone brought that algorithm to me, and I probably saw the same video she did, and it was this doctor talking about nose slimming, using that, and she mentioned that using it at a certain energy, it's very thin, like a minute amount of subcutaneous fat there, and then using the microneedling to obliterate that, which I don't think I'd recommend that. Fat is important in the face, and I don't know if it really has an effect, but definitely tightening from the collagen remodeling. So there was a study by Tanaka showing that. So that is an option in terms of radio frequency and slimming the nose. We also use it with malar edema. So if you've got a bit of malar edema here, we use the radio frequency, and we even do the nose, but that's with the non-ablative, non-invasive heads of our radio frequency device, the EndyMed. The other thing you can do, I think I'm going to need a little mirror, is again botulinum toxin. So just using this here, I'm not going to poke myself, but here on the ala, putting that in reduces the flare, and then on the sides of the nose right here and here, injecting that also will reduce the bulb, of the bulb of the nose, I think. And then on the sides, those where you get those bunny lines, if you inject that, it also leads to, like, especially if you get puffy in the morning, I wouldn't suggest injecting your bunny lines. And your bunny lines aren't just the muscle here, it's also your orbicularis oris, the crow's feet muscle, as well as your glabella, the frowning muscle, that has an impact there. And then sometimes if over injected, it could make your nose look a little broader. Injecting down here with botulinum toxin also lifts the tip. So, keeping it in this area could give you like a lifted, slimmer look. But remember, it is very subtle. And there's something called, I'm going to use the brand name, but they call it Oratane nose. But it's prescription isotretinoin, which is the prescription drug that they use for acne. So you might find that if you're taking that, there might be like a thinning of your nose, and that's because the sebaceous glands shrink, and some people maintain that afterwards with retinol or even a prescription tretinoin. So that's pretty fascinating. And then also fillers, so high G prime fillers. I don't like doing fillers in the nose, so it's my personal preference that I don't, but putting filler along the bridge of the nose can also give that effect of slimming and illusion, changes the light reflection as well as thread. So if you have any questions, and of course there's the surgical intervention, so that if that is a better solution, it's best to have a consult regarding a surgical intervention. So if you guys have any questions or have any suggestions on what else I can talk about, drop in them in the comments down below. Like, share, and subscribe. Thank you.